One of the best parts about emergency medicine is the stories. The fact that you can walk into any room, cocktail party, dinner, you are very likely to have the best stories of anyone in the room. And uh, I love telling stories. There are certain ones that I tell over and over again. And one that I don't think I'll ever forget from my intern year was a patient who was a prisoner who asked their officer if they can use the bathroom. And the cuffs were removed. Patient goes into the bathroom, door gets closed, and there's a bit of a commotion and shuffling. And so we try to get the door open, but it's locked from the inside. We have to get environmental. And by the time we get the door open and look in, what we see is the patient's feet disappearing into the drop ceiling of the emergency department. The patient had figured out how to crawl up into the ceiling, thinking, seems like a reasonable way to escape. And so the patient is crawling around in the ceiling while we are still trying to take care of the patients in the emergency department. So you'd hear a shuffle, 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 and then all of a sudden a tile would fall out of the ceiling or a foot would poke out, all this kind of stuff going on. After about 20 or 30 minutes, the cop is like, I got to go get this prisoner back. So tries to go up into the ceiling. Now, the problem is that the patient weighed all of about 80 or 90 pounds. The cop, with all of his gear, weighed upward of 250 pounds. And so as soon as that cop went up, came careening down through the ceiling. So now, of course, we got to take care of the cop and this fall as well, trying to take care of all the other patients while the ceiling is literally falling down around us. Eventually, SWAT comes in and FIDNY comes in, and they are able to trap the patient in the ceiling. And so the patient finally is caught, extracted from the ceiling and removed from the emergency department. But I don't think I will ever forget it. And I am not sure that it's ever happened any other place. What it really teaches you is don't have a drop ceiling in your emergency department.